evening once again, and welcome back from that short commercial break. Today I have here with me Farm Lucia Adai. She's an oncology pharmacist and she is also the executive secretary of Pharmaceutical Manufacturers Association of Ghana, and we are honored to have her on our show today. Welcome to Healthpoint show.
Thank you so much for having me. Good evening to all the viewers out there. I'm grateful to be here. I think that we're going to have a very interactive and educative session discussing the myths and facts of breast cancer.
Okay, so if you're watching us live on Facebook, the ID is Shakira Aziz. Please create a watch party, click on the share link and share with all your friends and loved ones. To begin with, I'm sure somebody watching us, the person might have heard so many things about breast cancer. Some people might also know that, okay, breast cancer, they know it's an illness of the breast. Don't really know what, so can you take us through what exactly is cancer before we come to breast cancer?
Okay, so cancer really is the abnormal multiplication of cells, and it can happen in any part of the body. So ideally, every cell has a cycle. The cells would be built, they will grow, and at a point in time, there are some parts that are supposed to die. But there are cells that grow, and instead of some parts dying off, they don't die off, and then abnormally multiply. That is what cancer is. And then once it occurs in the breast area, of course everybody knows where the breast is. Men have breasts, women have breasts. Breast cancer affects women mainly, but there are men that rarely also get breast cancer. So breast cancer or cancer generally is abnormal multiplication of cells in the breast area.
Oh, okay. So do we have, what are some of the risk factors that are responsible for breast cancer?
So there are several risk factors that you could have. The fact that you are even a female is a risk factor, yes, because I mean, if it largely affects women and you're a woman, then of course the fact that you're a woman makes you predisposed to having breast cancer. There are people who have had breast cancer in their families, so that can also be a risk factor. And then if maybe somebody in your family, uncle, auntie, cousin, mother, sister has had breast cancer before, that can also pre-expose. Usually 5 to 10% of the population who have had breast cancer in their family before are predisposed to having that. There's a gene called the BRCA1 and 2. Usually when you have that also in your family, then you are predisposed to having breast cancer. If you take in alcohol, if you are obese, there's that tendency that you could also, get a cancer in there. If you're a lady who started your menses a bit earlier, before 12 years, that's a risk factor actually. Yes, so the thing is, so that's how we need to get the education out there. And luckily, breast cancer is something that you can actually identify. You can just look at your breast and examine it, and then you can know if there's a lump or there's some abnormalities. But you must know what your breast looks like. So if you don't, please get a mirror and look at what your breast looks like. If not, get a partner or a doctor or somebody else to actually look at it. Also with the risk factors, if your menopause is a bit delayed, which means that if you have it after 40, 50, you could have a risk of having breast cancer. If you've been on any post-menopausal, hormone thing, or let's say you started some hormone therapy, some people do emergency contraceptives or some hormone therapy of the like, it could actually predispose you to having breast cancer.
Oh, really?
Yes.
Okay, so I'm sure some people watching will be, okay, so it means that once I have these genes, I have breast, I will definitely get breast cancer. It's not necessarily that everybody that has that gene in their family, they are supposed to have breast cancer.
So there's a lot of research ongoing about the relationship between this BRCA1 and 2 and breast cancer. I cannot state categorically based on any article to say that once you have the BRCA1 and 2, it means that you have breast cancer. No. But usually you would have most of the people having that gene actually having breast cancer. I think that the fear is not as to whether you get it or not. The most important thing is being able to manage it. Because from some of the research I have done, what I realized was that you would be able to get some amount of good management if you come in early. So if the cancer is contained or defined in a certain particular place, either in the breast, somewhere in the lymph node, and we can just take it out by surgery or radiation or something, then you are sure that you can live your 5-year period of cancer survival, or you can even live a full year. And I can tell you that there are people that I know who have had breast cancer and they've had lumpectomy or some lump being taken out of the breast, and they've lived 20 years, had children, and they've lived their full lives.
So that means breast cancer is actually curable.
So what I'm saying is that it is manageable.
Oh,
Manageable because when we are going into the myth, we realize that there are people who would have breast cancer and they can have it again. So curing is saying that it won't come back again. It can't come back again. And then in cancer terms, when you live for 5 years, that's a full life. So living 5, 10, 20 years is such a big deal, in cancer terms. So I think that the point is to get that awareness out there. Once we get the awareness out there, the need of getting the awareness out there is because, one, we can reduce mobility, we can reduce people getting sick because of cancer. If they come in early, you come and get your surgery done and then you go out. I mean, in a week or two you are fine. But if you don't and then it moves out of the breast area, then what happens is that you are going to be suffering from all the complications for years upon years, before you exit. And I think also that if we can be able to spread our awareness so people come in early, it reduces mortality. People don't die, be able to extend their lives. They'll live full years, 20, 50 years, and be able to do whatever they want to do, which is important. Also, cancer or breast cancer comes with a certain burden on the family. Financial burden, emotional burdens, and all of that. So it's important that we tackle all of those things. And I think for me, once it is manageable and there's help out there, I think we should get the word out that come and get the help.
Okay, so talking about help, where are some of the locations that we can get this help in case you think that you have breast cancer or you are worried that you have breast cancer?
So let me use this opportunity to thank all the partners who are promoting breast cancer, who are doing free awareness in churches and in other places, even in the hospitals. You realize that even though it comes to the token, there are some facilities that are saying come in and get your breast screened for free. So there are so many places you can get your breast checked out now. There's Kolebu, there's Fonfanoche, there's Sweden Ghana Medical Center. There are several places. There's Nyako. There are several places, even pharmacies that are saying that you can come in and we'll teach you how to examine your breast. It's also available online, and then once you do that, you can, if you are not comfortable with whatever you find, then you can actually get professional help. So there are several places out there, clinics, hospitals, there are doctors, there are nurses, there are pharmacists who can help you with the examination of your breast, and I think there's help out there, so we should go and get the help.
Okay, so in terms of the breast, when you were speaking, you spoke about the fact that we should know a normal breast. Is there anything like a typical breast? How is a normal breast supposed to look like? And if I have cancer, how do I know that I have cancer?
Okay. So, like I said, the foundation is to know what your breast looks like. If you know what your breast looks like, if one is getting bigger than the other, you would know.
Okay.
If it's getting harder than usual, you would know. If there is a lump.
Not to cut you, but some people have breast that one is already bigger than the other.
So you know your breast cancer? No, that means that's how your normal breast is like. Fantastic. Okay. So once you know that's how your normal breast is like, then it is fine. But I mean, assuming that you have this breast being bigger than this one, and then suddenly you realize that this one is doubling, tripling, becoming way bigger than this one, then there's a certain cause for concern, and you need to get it checked by a medical health professional. So what I'm saying is, fundamentally know how your breast is like, so that when there are any changes physically with the breast or the nipple, there's any bloody discharge, any abnormal discharge, you will just know. If your nipple retracts, goes backwards, you know that there's something wrong. If there's any sore, any ulcers around your breast or nipple, you would know that there's something wrong. If there's redness, there's anything, either with the nipple or the breast, you would know. Any warmth, anything, you would know. And it will help you to take good care of your breast, and it will help you.
Oh, okay. So if you are just joining in, I've been doing this with Lucia Adai. This show is brought to you in collaboration with Community Pharmacy Practice Association of the Pharmaceutical Society of Ghana. And we'll be talking about breast cancer. We are going to delve into the myth, and then we also look at the facts of breast cancer. And then from the discussion, we just realized that there are some symptoms of breast cancer. You have bloody discharge, nipple retraction, if there's swelling on your breast, if the skin of your breast changes. Please, if you don't know how your breast and your normal breast look like, kindly take the mirror from right now, look into the mirror and examine how your breast look like, so that in case you start seeing any changes or anything, you can report to the nearest clinic. And there are so many avenues that are ready to assist to Kolebu and all the public hospitals, they are all available and they are ready, more than ready. And also remember that breast cancer awareness doesn't end from today or tomorrow. The awareness still continue. You knowing it is not enough, but you practicing is what it is important. So now let's look at some of the myths that have been said about breast cancer. Many people have this conception that breast cancer is this, is that, is that. Can we dive a little bit into some of the myths so that you can compare it with the facts that is actually available? So some people have this notion that if I'm a man, I won't get breast cancer. Is that true?
No, it is not true. Like I stated in my earlier submission, men can get breast cancer. Men do have breasts and they can have breast cancer. So it's important to know that breast cancer largely affects women, but if you're a man, you are still, predisposed to having breast cancer. And so you need to also check your breast, either standing and looking at your breast in the mirror, lying down, examining it, massaging it, TLC in your breast, tender loving care, or whatever you can do to find out how your breasts are doing. And if there's any lump somewhere, any growth, any abnormality, any discharge that you think is abnormal, then you should get help from your healthcare practitioner.
Oh, okay. So we have this market women that most of the time they put their phones in their breast, their brazier, and they even put their money just for easy access. Do you think that if they do this, they are predisposing themselves to the radiation of the phone and they can get breast cancer?
Okay, so I have to state that I haven't seen any article, any clinical paper that has stated that putting your phone around your breast area can expose you to breast cancer. But I will state as a healthcare practitioner that I don't think it's a healthy practice to put your phone around your breast area. I think that if you can get a purse, a bag, a pouch or something that is a little away from your body, it helps with taking the radiation away, because the phones carry radiations and it's not healthy to have it too close around the body. Sometimes even the vibration can make you very uncomfortable. So even aside cancer, I think there are definitely health implications of having your phone or money, which has chemicals and all of that around your personal, your body So I think that it is not something that people should practice, because I also don't think that it causes breast cancer. Maybe over the long term, and then when we have a certain pattern, we can have a certain clinical paper to say that these people put their phone around their breast area for a long period of time, and we realize that they develop breast cancer. But as of now, I didn't find any clinical paper supporting that.
Okay. In our community, the Ghanaian society, most people have this notion that breast cancer is a spiritual illness. So the moment they have breast cancer, they said, the people have started. Do you think breast cancer is a spiritual illness and there's cause for alarm?
Okay, so let me state as a pharmacist and as a healthcare practitioner that breast cancer, any other disease, is not a spiritual problem. I know that we had that challenge in the past, or we still have it, and then you have people coming in who have been to the herbalist for a very long time, or they've been to the prayer camp. That is not to say that the herbalist and the prayer camp don't have a part in the management of breast cancer. There's a lot of support that any patient that's affected by breast cancer would need, emotionally, financially, even spiritually. What I'm saying is that if you come in early, you can manage it. So rather than just fighting it spiritually, God has given us the brains to be able to manage it with all the either surgery or medication, chemotherapy, all the medications that we have that we can use in managing breast cancer. So don't stay at home, don't stay at the prayer camp, don't stay at the herbalist place. You can visit that place and get whatever support you need, but do come to the clinics and the hospitals and get the needed support that you need to manage your breast cancer.
Oh, so I know that one of the symptoms of breast cancer is a lump in your breast. Does that mean that any lump that I find in my breast is cause for alarm, I have breast cancer?
No. So breast cancer, yes, is usually a movable lump in the breast. The breast itself has a certain lump, it's a bit large, which doesn't move much. So if you know what your breast even feels like, ideally, especially for women, you would know that there's that mass, call it lump or whatever, there's that mass, fatty tissue that sits, that produces the milk and all of that.
Oh, okay.
And it is usually in the breast. And so any other thing, you could say that this is breast cancer. However, sometimes depending on your menstrual cycle, your body, the infections and all of that, you could have things that may make breast cancer. So not every lump in your breast is breast cancer. Some of them are just the let's say adenoids or the fibroids or whatever it is that just form and then go away after some time. Some of them are infections and all of that. So it's not every lump that is breast cancer, but if a lump persists over a period of time and it is not your normal breast, if it's not what is in your normal breast, you should get some help from your medical.
Okay, so the normal breast itself has a lump sitting in there.
It has a mass, yes. It has a mass
sitting in there.
Yes.
So as a layman, I'm trying to do self-examination. How do I know that this lump is a normal one and this one is breast cancer lump?
So that's why we are trying to get the awareness out there that self-breast examination should be every day. If you do it every day and you've done it for the past maybe 10 or 20 years, you know what your breast feels like. You know what your breast feels like when you are standing, applying pomade. You know what your breast feels like when you are lying down before you sleep. You know what your breast feels like. You know what is normal, the mass that is normal, and the one that is not normal. So of course, when you know that, then once there's any other lump that comes up, you'll be able to tell that this mass is not normal, this one is normal. And I think that is why we need to get the word out there. Awareness, awareness, awareness. Tell a friend to look at their breast, to get a partner to look at their breast, to get a health practitioner to look at their breast. Continue to look at your breast all the time to know what is normal and what is not normal.
Okay, so there was this friend of mine that came to me that he had this discharge, I think creamish, from the breast, and she was so worried that she's going to die tomorrow because she has breast cancer. And I tried all my best to calm her down. I'm still trying my best. I know right now she's fine. So I want you to help me talk to her. She has nipple discharge. Does that mean that she also has breast cancer?
So not every nipple discharge means that you have breast cancer. As a woman, you would have some discharge from time to time. Whether you've had a baby and you're having that discharge, or whether your hormones are at a certain peak and you're having that discharge. If it persists and you are not comfortable, please get help from your healthcare practitioner. It's important to get that done. And I think for me, if you know your breast very well, if there's a bloody discharge, you would know, because in being part of the breast self-examination, one of the things you do is that you actually would squeeze your breast a little to see whether there's a discharge. And like you're saying, your friend thinks that it's all gloom and she's going to die and all of that. I think we should be able to communicate that if you come in early, whatever it is very manageable. So coming in early can save your life, and it's very, very important. So don't be worried about whether there's a discharge, what color. Just come in early and let's do something about it.
Oh, okay, so if you're just joining in, we are talking about the myth of breast cancer. There's this notion that if you have a discharge in your breast, it means that you have breast cancer. Please, it's not every discharge that you have in the breast that is breast cancer. Unless it's a bloody discharge, then there is cause for alarm. But if it's a milk discharge, then it could be other hormonal changes or any other thing. That is why it is best for you to report to the health professional, or you report to the clinic and you be attended to. This show is brought to you in collaboration with Community Practice Pharmacists Association of Ghana, of the Pharmaceutical Society of Ghana. We are right here live on Facebook, and we are talking about the myth and the fact of breast cancer. Familia, you know there is this notion that, okay, I have a history of breast cancer in my family. It means that whether I go to heaven and come back, I'll also get breast cancer. So I have to be prepared and start writing my will as soon as possible. Is that also true?
No, that is so not true. So like I mentioned earlier, even for hereditary, what I realized that it's just about 5 to 10% of the people who have had that in their family that actually have breast cancer. So it's not everybody that will get breast cancer because you've had it in your family. I think that the message that should go out, if you don't remember anything at all, is that it is not about whether you have a lump, a discharge, a retraction, or anything, a swelling, or anything of that sort. The thing is, if you are not comfortable with any abnormality of your breast, please see your healthcare practitioner. Get help. The earlier you come, the more hope we can have, the more we can do for you, the more we can extend your life and all of that. So the awareness should be, come early so that we can do something about it. If there's something you don't understand, please ask your healthcare practitioner. Ask the questions that you're supposed to ask, and I'm sure we'll be able to answer you.
Okay, so people. Okay, when COVID-19 came around, even when you cough or even when you go close to someone, the person is scared that I'm going to get COVID-19. We can't shake anymore. We can't hug. People also have this notion that okay, I've seen this woman somewhere, and then she has breast cancer, so they don't want to go close to the person because they feel that they will also get breast cancer. Is breast cancer contagious?
Okay, breast cancer is not contagious. Like I mentioned earlier, cancer is the abnormal multiplication of cells. It happens internally, not externally. It's not an infectious disease, it is a non communicable disease. And so it doesn't move from person to person. So if somebody has breast cancer, they are the only ones that have breast cancer. They need the support that you can give to them. It's important that you relate to them. I'm not saying you should go against your COVID-19 measures of not doing your social distance and all of that. But what I am saying is that breast cancer is not contagious. You will not get it from relating with other people. It's important to extend the support to people who have breast cancer. And I mean, I think I've also heard somebody said that it was sexually transmitted. Breast cancer is not sexually transmitted. You will not get breast cancer by having sex with somebody. That is not the point. The point is that it's something that happens internally. And people who are usually affected by breast cancer have been exposed either to some radiation or they've had one of the risk factors. What is important is for them to come in early and get the help that is available, and for us to also give them the support that they need.
Oh, okay. So there's this notion that there's no bra day in the month of October, and many people thought too much of brazier causes breast cancer. That is why there is a day that was set aside that no lady should put on bra. If you wear too much bra, wear it to bed, wear it to work, can you get breast cancer from that?
So I think that would also be an interesting topic for research, and I'm sure that the Oncology Pharmacy Association of Ghana would actually take it up one of these days to actually look at if there is any relationship between braziers and breast cancer. As of now, we don't have any clinical evidence that backs that too much brazier can actually give you breast cancer. I think the reason why we did the Tatas Day or the No Bra Day is so that people can see breast. People will be able to see nipple. People can see breast everywhere because when you put up the bra, you sort of mask what the breast looks like. But once you let the tatters free, then people know what it looks like. So I think that whole thing was done for more of awareness. And I think we still need to get the awareness out there. There are people who get breast cancer or ulcers of the breast and they stay at home and they put all sorts of concoctions on it and they go to all sorts of places. What we are saying is that there's help out there. Come in early and we'll be able to manage the situation with you. If you don't understand something about your breast, come in early. If there's something that is happening to your breast, any growth in the armpits, any lump, any discharge, any retraction, any blood, or anything that you don't understand, please visit your nearest clinic or hospital, see a specialist or a doctor or anybody who has an interest or has some understanding of cancer and let them help you. There are so many hospitals now that are actually helping with the campaign, the awareness, and so the information is out there. Get help out there, and there is help out there. You can live longer even if you have breast cancer.
Oh, okay, it has been an interesting conversation. You can live longer if you have breast cancer. The fact that you have breast cancer doesn't mean that is the end of your life. And if you put on too much bra is actually meant to support and hold the breast. But you also have to know that too much of everything is bad. Sometimes you have to leave it and let air flow so that you can feel free. And the day that was set aside for no bra is not because people get breast cancer from wearing too much bra, but it was also set aside in order for us to remember the people who have breast cancer, that sometimes because of their breast cancer and their breast has been cut off, they can no longer wear bra again. So it's set aside to create awareness and also remember the people who get breast cancer. And we are having this show in collaboration with Community Practice Pharmacists Association of the Pharmaceutical Society of Ghana. If you are just joining in, please click on the share button and share for everyone. Create a watch party and let others benefit from what we are discussing. And coming back to another myth that I just remembered, the roll-on and the perspirance. There was a friend who told me that as for her, she doesn't like the roll-on because she has heard that it will cause breast cancer because of the chemicals. The chemicals are too much, and too much chemicals can cause breast cancer. Is it true that putting on roll-on and deodorant spray, you can get breast cancer.
So again, I haven't seen any clinical paper that states that once you use a deodorant or antiperspirant, you'll be able to get breast cancer. I can show you people that have used roll-ons for a very long time who don't have breast cancer. I don't have enough evidence to support that claim, and I will state that you can use your deodorant if you are not comfortable with the chemicalized ones. There are natural ones that you can use.
Oh, really?
Yeah, to take. Of course, people have all these lime, things that they put under the armpits and all that. You can shave regularly and all of that, and that would help, lots of aeration around the area. What I'm saying is that there's no evidence to support that claim. If you're not comfortable with roll-on, you can find another alternative to keep whatever the body hygiene, being optimal. But it's important to know that even if there is breast cancer, if you're not comfortable with something, there is help out there, so get the help.
Okay, so in terms of detecting or diagnosing breast cancer, I know there is this mammography that you can do. When you do it every year, like annually, does that protect you from getting breast cancer? So once you do it this year, you know that you are free, you won't get breast cancer again. So do you advise that you do mammogram every year to protect from breast cancer?
So mammogram is more like an x-ray of the breast. And usually we do x-ray of the breast because women above 40, especially those who have had children, they've lost some elasticity or some let's say fatty tissues around the breast area, and because of that their breasts are a bit light, and so they would want to put it in a device to take an x-ray. I think mammograms are good, and I think that you should get it done every year if you are 40 years and above, but it doesn't protect you from getting breast cancer.
Oh, okay.
I think one of the things that is very helpful is for you to do breast self-examination, which you do every day, because you don't have to wait till next year to find out whether there's something wrong with your breast. If you are checking your breast every day, then you know if there's something wrong with your breast or not. So it's important for us to check our breast every day, and if there's something that you're not comfortable, ask your healthcare practitioner about it. I think that is one of the best ways, not of preventing, but of managing breast cancer, because you know there's help out there and you are on your guard. You don't have to wait every year to check what happens the rest of the year. What if there's a development? Do you wait till another year? No. So you can get help. You just make sure that you check your breast every day while you're applying the cream, while you're lying down. Ideally, it's very good to do it a week after you've had your menses or within that period.
Oh, okay.
Yes, because of the hormonal balances. But whatever the case is, do know what your normal breast looks like, so that would help you to be able to do the best you can for yourself.
Oh, okay. So if you're just joining in again, this is the Healthpoint show, brought to you in collaboration with Community Practice Pharmacists Association of the Pharmaceutical Society of Ghana, and I've been doing this with Fam Lucia Adai. It has been an interesting conversation. I hope that you've learned a lot. Learning does not only end with you. Please share with your friends. Click on the share button, create a watch party, and let everyone benefit. You can also follow us on all our social media handles. On Facebook is Healthpoint Show, on Instagram Healthpoint_show. Subscribe to our YouTube channel. The name is Fam Shakira, and click on the bell and select all. That gives you notification anytime a new video is uploaded, and you will be educated. And coming back to our myth again, this one is really important to me. People have this notion that there's diabetes and it's as a result of sugar and all other stuff. So if let's say I take too much sugar, I'm a fan of sugar, does that mean that I'm predisposing myself to getting breast cancer?
Okay, no, it doesn't mean that you are predisposing yourself when you're taking too much sugar. Thinking about this myth, and you mentioned the social media platforms, I have just also remembered that I also have a YouTube channel. It's called Lucia there. You can find it on YouTube if you search for the name. I have some things going on Instagram and Facebook, but mainly on my YouTube channel. And I did something on dangerous myth on breast cancer, and this actually came up. It was one of the things that my viewers wanted to find out about. So I would say that, first of all, diabetes doesn't mean that you're taking too much sugar. It means that your pancreas is not working like it's supposed to work. And also, cancer doesn't mean that you're taking too much sugar. There has been some correlation to say that when you have cancer, you take too much sugar. It could make the situation a bit worse. But I don't have a lot of clinical evidence to support that. So I think it's important that you do everything in moderation. Don't take too much sugar. I mean, if you don't need it, don't take it. And then to note that sugar doesn't necessarily cause breast cancer. It's important to take your sugar in moderation. And it's important to note that breast cancer is the abnormal multiplication of cells in the breast area. It's an internal process. It takes a lot of gene mutation to have that happen, and not necessarily the injection of glucose or sugar.
Okay.
Yes.
So you've heard it all. Please, sugar does not cause breast cancer. So those who are alarmed that they take a lot of sugar and you get breast cancer, you will not get breast cancer from taking a lot of sugar. But remember, too much of everything is bad. Someone will also say, okay, so I'm a very, active person. I don't take alcohol. I don't smoke. I exercise a lot, like 4 times in a day, 4 times in a week. And I take a lot of fruits and vegetables, so I'm fit. I can't get breast cancer. People have that notion that because they are very religious in terms of healthy living, they'll not be able to get breast cancer. What do you have to say about that?
What I would say is that nobody chooses their cancer. Nobody chooses where the cancer would happen. Being healthy is good. Making sure that you stay in weight, exercise, and not taking alcohol, not smoking, and all of that is good. But it still doesn't exempt you from having breast cancer. You could have breast cancer. Breast cancer has, let's say, its own gene way of coming up. There is a lot of mutation that happens. And sometimes, even though your diet and everything might be right, you still can get breast cancer just because you're a female, you've been on hormone therapy, or you've done something of the like. Maybe you started your menses early, or menopause came in late, or you didn't have a child. A lot of which is not even under your control. So you can live healthy, it's good. It's good to support that with it. I mean, to be able to avoid obesity, it's important that if you can stay away from alcohol, you do. If you can exercise, you do. If you can, take a balanced diet and make sure you're eating healthy, you do. But it doesn't take you away from getting breast cancer.
Oh, okay. So do we actually have control or a way that we can prevent this breast cancer? Do we have some factors that we can control on our own as individuals so that we don't get breast cancer?
So in the research I did, there were 2 things I realized. In the risk factors, there are some of which we don't have control over. You don't have control over the fact that you're a female. You don't have control over the fact that you start your menses early, or you are starting menopause late, or you didn't have children, or anything of that sort. But then there are other things that you have control over. You have control over your diet, what you eat, your alcohol, what you are taking in, the smoking, you have control over it. You have control on whether you should take some hormone therapy or not, either for contraception or any other things, postmenopausal. There's a few things that you have control, and very importantly, you have control on checking your breast every day to find out whether there's any lump or any abnormality. Because it is the checking and finding out and coming in early that can help us to manage it and do something about it. If you don't come in early, then there's not much we can do about it. So I think the main awareness that has to go out is coming early. Coming in early can save your life, and that is what we also expect of you.
Okay. So you say we have control of our breasts. Is there any special way of doing this breast examination, like self-examination? Because people think that just squeezing it and holding it anyhow, examining yourself every day.
So there are several ways of checking your breast. I also have a video on that on my YouTube channel, so you can look for me on Lucia there. I think basically it's important to know what your breast looks like. So you can do breast examination by standing in front of the mirror and actually massaging the breast tissue. So you can go from this area and then go up and then come down. You can also lie down and have it done. So you can lie down, relax, put one hand under your head and actually massage. Even while standing, you can still be able to either cross your hand and have it done, check the lymph node area and all of that. The most important thing is to be able to know what your normal breast tissue looks like. The nipple, is it retracting? Is there any discharge? Is it bloody? What is happening? Is the mass okay? Is my breast tissue hardening up? Is it red? Is it inflamed? Because you could have an inflamed breast cancer disease, but it doesn't necessarily mean that you have breast cancer. So it's important to know what the normal breast looks like, so that when there's any abnormality, you can get help. So just keep checking the breast while standing. So you can, I mean, it will be difficult for me to take off my dress and then actually do a breast something. So that's why I'm trying to tell you about how to do it. So just massage. So you have your fingers this way, and then you just massage. You can put your hand behind your head and just massage from this area and up, and then come to the other side and then down. And then you make sure that you know what the normal breast tissue feels like. You can squeeze the nipple a little to find out if there's any discharge. You can also examine it, the whole area, to find out if there's any hardening, any lump, or anything of that sort. And once you keep doing that, you will know what the normal breast feels like, so that if there's any abnormality, you can take care of it.
Oh, okay. You know, there was this issue that pain is also a factor of breast cancer, right? So people think once they have pain in their breast, or they have this tinkling effect, something moving through their breast, then they think they have breast cancer, and they become really worried. Okay, I'm going to die tomorrow.
So breast cancer is not death sentence. There are several people that have had breast cancer and they are fine, they are alive today. Having any pain, any tingling, any sensation in the breast does not necessarily mean that you have breast cancer. If you're uncomfortable with something in the breast, you should get help. There are lots of breast diseases, or there are some hormonal changes that can affect your breast that may look like breast cancer, but it is not breast cancer. So if you're not comfortable with any changes in your breast, around the nipple area, any discharge, please get help. You know, speak to your healthcare practitioner. Ask questions. Go online. It is not a death sentence. Come in early and we can do something about it.
Okay. I'll be doing this with Family Lucia Adai. She is the executive secretary of the
Pharmaceutical Manufacturers
Association of Ghana. And this show is brought to you in collaboration with the Community Practice Pharmacists Association of the Pharmaceutical Society of Ghana. We are right here live on Facebook, and you can follow us on all our social media handles. On Facebook is Healthpoint Show, on Instagram is Healthpoint_show. Subscribe to our YouTube channel. The name is Fam Shakira. Click on the bell and hit the all. When you click on the bell, you see options. Click on all. When you click on all, it gives you notification anytime a new video is uploaded. Please click on the share button, create a watch party, share, and let everyone benefit. Once we are done, the video will still be on Facebook. Once you get there and you search for it, you will still find it. And we'll be discussing myths of breast cancer. We've learned so much. We've learned that breast cancer is not a spiritual illness. It's not a death sentence. So if you have breast cancer, that doesn't mean that you are going to die tomorrow. If you use deodorant spray, you not get breast cancer. Please, breast cancer is not coronavirus that when somebody has breast cancer, you can't get close to the person. It's not contagious. It is actually manageable. If you say it's curable, then it means it might not come back. But it is manageable. The fact that you have it today and you've been taking care of doesn't mean that you won't get it again. You may get it again. So report everything that you don't understand, everything that troubles you concerning your breast. Report to the nearest clinic, report to your healthcare professional. You can go to any community pharmacy. There are so many community pharmacies in every corner. Every corner has a community pharmacy. You can visit a community pharmacy and let them know that this is what you are going through, and they are ready to, assist you with it. This show is once again brought to you in collaboration with Community Practice Pharmacists Association of Pharmaceutical Society of Ghana. And I have here with me Family Lucia Adai. Thank you very much for gracing our occasion. Can you give us your last word on breast cancer before we wrap up?
So thank you so much for having me on the show. It's been a fantastic session of finding out what viewers think, what the myths are, and being able to come in with some real facts. I'm sure we as scientists would also do our homework, to do a lot of research, to come back and tell you what is really the current trends. My last words are that breast cancer is preventable. you should not die of breast cancer. There's so much help out there. There are so many health professionals now that have interest in breast cancer that can help you. It is not a death sentence. Do not think that because you have a lump, there's something going on wrong with you and all of that. I mean, people have had that experience where there's a lump and then they shut off because they think they're going to die. Come in early and we can do something about it for you. If you come in early, you can live your full life. I have known people who have had breast cancer and they've had some form of surgery or therapy and they've lived their full life. Do not listen to the rumors out there. Come and listen to the facts. Come and get help. There is help out there, and I'm sure that we'll all be very happy.
Okay. So please, your questions and your answers, because of time, we might not be able to take them, but please write them in the description box. I'll look at it and then send you the answers on my Facebook page. And thank you so very much for joining. Please share the link for everyone to benefit. This is your Healthpoint show, your favorite health education program, live on YouTube, Facebook, Instagram, and all other social media handles. On Facebook is Healthpoint Show, on Instagram is Healthpoint_show, and on YouTube is Farm Shakira. Please subscribe to our channel. Thank you very much. I want to thank all our supporters and our sponsors, Community Practice Pharmacists Association of Ghana. We want to thank Farm Lucia Adai for making it possible to this show. It has really been fantastic. I know you had a show before this one, but yes, though you were available. We appreciate you and we are honored to have you. Thank you very much for having our show.
Thank you so much for having me. I hope we do this again. I think next month there's something on prostate cancer. We can do something on mental health and the rest. So probably your viewers should let us know what health thing that they want to know, or what health issues are burning, and we'll be able to address it for you. Thank you so much for having me.
You're welcome.